I work with people who have had injuries to their brain, so they might have had a stroke, some people might have had an accident in a car. That means it's affected their communication in some way, or perhaps their swallowing, they may no longer be able to swallow as you or I can.
I myself work in neurology, which is working with patients who've come in following strokes, spinal cord injuries, head injuries, things like that.
They may not be able to get the words out that they want to say anymore. They may not be able to read, or they may not be able to write.
Then you can also work in ITU, intensive care, which is somewhere that people don't often think that physios work, but we have a big role there.
I help people to gain independence following illness or disability. It's very difficult to define occupational therapy in a succinct phrase, but we usually use purposeful activity to rehabilitate people, and my job varies from area to area, but at the moment I'm working with people with neurological conditions in a rehabilitation setting.
You end up working with a patient over a long period of time. You not only get to know how they tick, which is what basically one of our ways into helping them recover quicker, but also you get to know their families as well, and that just puts a broader picture on the work rather than maybe in a more musculoskeletal sports injury.
My route into speech and language therapy was quite unusual because I studied biology and German when I left school as a degree, and then went on to do speech and language therapy later as a postgraduate course, whereas a lot of people will go straight into it from school.
Where I work, you work within a team of physiotherapists, and so there's a lot of colleague support there, but also within the hospital you're working within a much bigger team of sort of occupational therapists, speech and language therapists, the surgeons, the consultants, and the nurses obviously.
I enjoy assisting patients to achieve the goals that they've set for themselves, and that's usually to gain independence in various areas of their lives, for example personal care, the domestic side of things as well, for example cooking or managing money, that sort of thing as well. I enjoy seeing them achieve their goals.
The NHS or a hospital environment is the best environment in which to learn. You've got a lot of contact with other more experienced professionals than yourself in physiotherapy. It's the team working again. You pick up a huge amount of information just by working alongside people. And as far as I'm concerned, it's provided me with the rewarding career that I was looking at. Every day is different, every day is varied, and every day you learn something.
I remember working with a lady who had had a very severe stroke. When I first saw her, she wasn't able to follow anything I said, to get any words out. And it's probably 2.5 years later now. She's living independently back in her own home.
I never met a physio. I didn't want to be a physio. I certainly don't feel that I want to be anything else, and I still haven't met anyone who would want to do anything else.
I think the NHS is supportive in that it helps us to continue our professional development, which is a requirement. After you qualify, you need to continue, keep your knowledge up to date, that sort of thing. And it's very supportive in that it provides a lot of training courses both inside the hospital and outside.